Brushing your teeth every morning and night doesn't guarantee that you're giving your mouth all the attention it needs. In this video, I will share dental hygiene tips to help you take your oral hygiene routine to the next level and prevent dental problems. First, take note of these dental terminologies and definitions. Cavities. Cavities are holes or structural damage in the two outer layers of a tooth called the enamel and the dentin. The enamel is the outermost white hard surface and the dentin is a yellow layer just beneath the enamel. Both layers serve to protect the inner living tooth tissue called the pulp, where blood vessels and nerves reside. Cavities are caused by bacteria in the mouth. Small cavities may not cause pain and may be unnoticed by the patient. Larger cavities can collect food, and the inner pulp of the affected tooth can become irritated by bacterial toxins, foods that are cold, hot, sour, or sweet, causing toothache. Dental plaque is a soft layer of proteins and bacteria that accumulate on the surface of teeth in between brushing and flossing. Because teeth do not shed on their own, the body cannot naturally remove plaque on its own, and the bacterial community on the teeth can be the most diverse community found on the body. If not removed properly, dental plaque begins to harden within 48 hours, forming the hard substance tartar, also called calculus, in 7 to 10 days. Tooth decay is the destruction of your tooth enamel, the hard outer layer of your teeth. Plaque, a sticky film of bacteria, constantly forms on your teeth. When you eat or drink foods containing sugars, the bacteria in plaque produce acids that attack tooth enamel. The stickiness of the plaque keeps these acids in contact with your teeth. This is when cavities can form. Gingivitis is a common and mild form of gum disease that causes irritation, redness, and swelling of your gingiva, the part of your gum around the base of your teeth. It's important to take gingivitis seriously and treat it promptly. Gingivitis can lead to much more serious gum disease called periodontitis and tooth loss. Oral health and brushing. Do you brush enough? The ADA recommends brushing for at least 2 minutes twice daily. If you don't meet the required timing, try setting a timer on your phone. Pick the right brush. The size and shape of your toothbrush should fit your mouth and allow you to reach all areas easily. Get a brush whose head and bristles are small enough to reach into the crevices of your molars where food debris can hide after you eat. Proper brushing technique. The American Dental Association has a technique for proper brushing. Place your toothbrush at a 45-degree angle against the gums. Move the brush back and forth gently in short tooth-wide strokes. Brush the outer tooth surfaces, the inner tooth surfaces, and the chewing surfaces of the teeth. Use the tip of the brush to clean the inside surfaces of the front teeth, using a gentle up and down stroke. Brush your tongue to remove bacteria and freshen your breath. When brushing, spend 30 seconds in each part of your mouth. Change your toothbrush or electric toothbrush head. Bristles deteriorate with time and usage. Many dental professionals recommend changing your toothbrush about every 3 to 4 months or sooner if the bristles are frayed, because when they become frayed and worn out, they can lose their effectiveness, and clinical research shows that a new toothbrush can remove more plaque than one that's worn out. Toothbrush bristles do not kill bacteria in the mouth, protect you against disease, or prevent you from getting sick, so you should change your brush regularly for maximum effectiveness. The American Dental Association warns that covering your toothbrush can actually breed new bacteria and introduce it into your mouth. Instead, just rinse your brush after each use and allow it to air dry. You should also avoid sharing brushes with others, even your kids. Bad breath is also called halitosis. Normally, you can improve bad breath with consistent proper dental hygiene. If simple self-care techniques don't solve the problem, see your dentist or physician to be sure a more serious condition isn't causing your bad breath. Most bad breath starts in the mouth, and there are many possible causes. They include food, The breakdown of food particles in and around your teeth can increase bacteria and cause a foul odor. Eating certain foods such as onions, garlic, and spices also can cause bad breath. After you digest these foods, they enter your bloodstream, are carried to your lungs, and affect your breath. Tobacco products. Smoking causes its own unpleasant mouth odor. Smokers and oral tobacco users are also more likely to have gum disease, another source of bad breath. Poor dental hygiene. If you don't brush and floss daily, food particles remain in your mouth, causing bad breath. A colorless, sticky film of bacteria forms on your teeth. If not brushed away, plaque can irritate your gums and eventually form plaque-filled pockets between your teeth and gums. Your tongue also can trap bacteria that produce odors. Dry mouth. Saliva helps cleanse your mouth, removing particles that cause bad odors. A condition called dry mouth or xerostomia can contribute to bad breath because production of saliva is decreased. Dry mouth naturally occurs during sleep, leading to morning breath, and it worsens if you sleep with your mouth open. Chronic dry mouth can be caused by a problem with your salivary glands and some diseases. Medications. Some medications can indirectly produce bad breath by contributing to dry mouth. Others can be broken down in the body to release chemicals that can be carried on your breath. Infections in your mouth. Bad breath can be caused by surgical wounds after oral surgery, such as tooth removal or as a result of tooth decay, gum disease, or mouth sores. Other mouth, nose, and throat conditions. Bad breath can occasionally stem from small stones that form in the tonsils and are covered with bacteria that produce odor. Infections or chronic inflammation in the nose, sinuses, or throat, which can contribute to postnasal drip, also can cause bad breath. After brushing, bacteria can still remain on the tongue, so be sure to brush or scrape your tongue every day. If you're using a toothbrush, put a little bit of toothpaste on your toothbrush and brush your tongue in circular motions. If you're using floss, take a piece of floss and wrap the ends around each finger, then gently use the middle to scrape and clean your tongue. Finish by rinsing your mouth. If you're using a tongue scraper, take both ends of the scraper in each hand and use the middle to gently scrape and clean your tongue. Rinse your mouth when you're done. Not only will it banish bacteria, but cleaning your tongue can also freshen your breath. It's recommended that you floss every time you brush your teeth, but at least once a day. Flossing must be done properly so that when you reach between teeth, you actually get to the germs that are stuck there. Use about 18 inches in length of floss, wind it around the middle fingers of each hand, leaving an inch or two to work with. This will allow you to use a fresh area of floss every few teeth without reinserting bacteria you just removed. Holding the floss between your thumbs and index fingers, slide it gently past the tight contact point between the teeth. Gently curve the floss around the base of each tooth, making sure you go beneath the gum line. Never snap or force the floss, as this may cut or bruise delicate gum tissue. Repeat this for every tooth. As you move to the next tooth, take the dirty floss with one finger and unwind the clean floss from the other finger. Make sure to floss the teeth at the back of your mouth too. To remove the floss, use the same back and forth motion to bring the floss up away from the teeth. For added protection, rinse your mouth with mouthwash after you brush and floss your teeth. Mouthwash can go where toothbrushes and floss can't, in order to rid your mouth of the same debris that irritates the gum line and causes gingivitis. Adding mouthwash to your oral care can increase the cleanliness of your mouth even when you're on the go. Simply sip a small amount of mouthwash and swish it around in your mouth for 30 to 40 seconds. Make sure your lips are closed, then spit it out. Fluoride rinses are not recommended for children ages 6 or younger because they may swallow them. Always check the manufacturer's label for precautions and age recommendations, and talk with your dentist about the use of fluoride mouth rinse. A saltwater mouth rinse is useful for many reasons. It's great for anyone who has a sore throat, mouth sores, gum sores, or recently had dental procedures. It doesn't replace regular dental hygiene, but it is used for extra protection. It also provides emergency dental hygiene in case you don't have your regular mouthwash or toothpaste in your possession. There's a history of salt for medicinal use. The use of salt for healthcare purposes has a long history, dating back to some of the oldest medical scripts in existence. According to the Science Tribune, ancient Egyptian papyruses from 16,000 BC provide recipes for a range of medicinal treatments using salt, particularly in anti-infectives. The ancient Greeks used it for similar purposes and already knew more than 2,000 years ago that it had anti-inflammatory effects. How does a saltwater mouth rinse work to reduce dental bacteria? According to Eric Shapira, doctor of dental surgery, quoted in Men's Health, it temporarily increases pH balance of your mouth, creating an alkaline environment in which bacteria struggles to survive. Because they, along with most other natural species, generally prefer an acidic environment, using the rinse often enough can make it difficult for bacteria to breed. To make a saltwater mouth rinse, add 1.5 teaspoons of salt to a cup of warm water. Oil pulling is an ancient Indian folk remedy claimed to whiten your teeth, freshen your breath, and greatly improve your oral health. Oil pulling involves swishing oil around the mouth, using it like a mouthwash. You can use coconut oil, sesame, or sunflower oil, or other ones, but I use coconut oil. In order to oil pull, you put a tablespoon of oil in your mouth and then swish it around for 15 to 20 minutes. The main benefit of doing this is that it reduces the amount of harmful bacteria in the mouth. How do you know if you have good oral health? Examine your mouth during your oral hygiene routine to make sure there are no abnormalities. You visit your dentist regularly for checkups and cleanings. Here are some factors that may indicate that you have good oral health. Your gums are pink and do not get sore or bleed when you brush or floss your teeth. Your teeth feel clean and not fuzzy. You don't constantly have bad breath. During your next checkup or cleaning appointment, ask your dentist if there is anything you should pay extra attention to during your oral hygiene routine. Stop or limit snacking. Reduce the daily amount of sweetened drinks. Use dental products that contain fluoride, including toothpaste. Drink plenty of fluoridated water with meals and along with sweetened beverages to wash away the sugar and acids. You should always seek the advice of your dentist or other qualified healthcare provider with any questions you may have regarding medical condition or treatment. I'm not a doctor, I just did some research on the subject of oral health. Thank you so much for watching this video. Feel free to leave your comments about the subject and don't forget to thumbs up and subscribe to my channel. I have other videos to help you coming soon. Have a wonderful day.